A very warm welcome, and we continue with our coverage here at the 21st International AIDS Conference, and we're looking at the progress that South Africa has made in the fight against HIV and AIDS. Now, when we speak of progress, one of the things that the country has been lauded for is with regards to the number of people who are now on treatment, access to treatment. 3.4 million people are now on ARVs in South Africa, and over 1.3 million of those are coming from KwaZulu-Natal, and it's something that the province has been extremely proud of. Earlier this week we spoke to the MEC for Health, Dr. Sibongiseni Dlomo, who took us through the program, in fact, on how the province was able to reach that number. It could not have been done without nurses. Doctors were not enough to ensure that all these patients could now start to be put on the antiretroviral programs. So it's been a great assistance that they started this program. Over 1,700 nurses were trained under the NEMART program. Now, joining me are two nurses who have been a part of this program, and their stories was also documented in a book that was in fact launched today. With me I have Mantombi Nzimande from Cato Manor, just outside Durban, and all the way from Utrecht we have David Howard. Thank you very much for joining us, to you both. Let me start with you, Mantombi. Tell us a little bit about the training. We know that it was different. It's different from the normal training that nurses would undergo. You went through a very specialized training program.
Yes, you did nursing training, and over and above that, we were sent for NEMART training, which is a 5-day training that deals with ARV and HIV. After that, you are exposed to mentorship, clinical mentorship from our district partner, which is Match Health System. They help you, they mentor you until you are competent, and then you can manage the people on ART.
And just, some of the stories, the experiences, and the people that you were dealing with on the ground.
With my experiences, I'm now able to manage a patient holistically because I integrate services. I managed a patient on ART as well as on TB. So I am able now to manage people and not compromise their care.
Right, let me bring in David, all the way from Utrecht, working more with Utrecht rural community. How was it? I know the challenges there have been quite different. You now had to ensure that people came out firstly to test.
Yes. Being in a rural community like Utrecht, it poses a lot of different challenges for us, because we sometimes have patients that need to travel about 3 hours just to access basic services like testing. But we've managed to make remarkable strides. We've used our CCGs, hats off to them. They've been helping us getting people to the clinic to get tested, because if it wasn't for them too, we wouldn't be able to test our patients and prep them for ART initiation.
And you also had to, of course, deal with the myths around HIV, and to try and convince people to say, you know what, let's come forward and let's test for HIV. When rather, there were stories that we've heard of people thinking that they were sick because of witchcraft, for example.
That's very interesting for you to raise that, because in my district we have been collaborating with traditional healers, and we find many patients too that are being referred from traditional healers for us to take over management on the HIV aspect of their care. So yeah, that's one of the things that we are doing as a district and as a rural, where you find a whole lot of inyangas, so to speak. Yeah, that's what we are all about.
Mantombi, stigma and discrimination is one of the challenges. It's said to be a barrier for HIV testing. How were you able to now, we're talking about convincing people to come through, but you still had to try and deal with people saying that if I go out, I'm going to be stigmatized, I'm going to be discriminated against?
We adhere to the department's protocol of confidentiality, and also to address the stigma, we test people at their treatment point. There is no designated area for testing, so every patient that going to any testing point can get tested at that point without going to a designated HIV testing center in the clinic.
And the response for people, are people now more willing to come out and come forward?
Yes, they are. And the other thing that we do, we don't advocate for voluntary counseling and testing. We initiate the patient and we ask them if they want to test. We come out and we ask them. So by doing that, I found that we are reaching a lot of people, because some people are even scared to start with the subject. And if you as a nurse tell them and talk with them and say, how about testing, and they say, oh, I don't have time, and you say, no, we can do it here in this room. So we have increased the uptake by integrating services in all service points.
David, young people, the concern around the new rate of infections, obviously in the areas that you have been, and the communities that you've been servicing, what is the response from young people?
We still have a bit of a challenge in dealing with young people, and as a response, our department has initiated this getting our institutions accredited as adolescent and youth-friendly services. So with this in mind, it is not just a Department of Health problem. So that model, it encourages you to use your existing services, be it services from the municipality or even other government departments. So we are working on that to get to strengthen basically what we already have and make even more gains in reaching that key population, so to speak, because a lot of the problems that we are experiencing later on in adulthood are as a result of us not being able to reach enough the youth at the adolescent stage. And
And I know your work is not only centered at the healthcare facilities, but you've also now been going to households, deep down into the rural communities.
That was one of the reasons why I decided to go back home. I needed to take all the knowledge and skills that I had learned, take it back home, because it's easier for me now to reach out to people, because I'm so to speak well known in the community. So it's easier for them to relate to me compared to a person that is not from the community. So.
And just, speaking about going back to the community, Madam, you're also now a part of the nurses who are now going to take this training that you have and impart that knowledge on your colleagues. We understand now that the goal is for at least 2,500 nurses in KwaZulu-Natal to be trained, and that's going to be partly your responsibility.
Yes, I am a NIMAT mentor, by the way, so I have started already with that training in my institution, because you cannot wait for formal NIMAT training when there is a need there. So by the time they go for formal training, you find that they are already initiating and they are already competent. They just go there for formality. So we are actually training them already.
And your work is not only centered around obviously just the training. I mean, when we speak about HIV and AIDS, we could also put in poverty. You're from KwaZulu-Natal. We know that there are informal settlements and a number of other social issues that come out of those areas.
We have a lot of social issues, and at the moment we are trying to spearhead our youth program, because we want champions from the community to help us. And we're also being helped by the community healthcare workers who stay in the community at KwaZulu-Natal, because they have better understanding about the people there. So they've been of great help.
David, same to you as well. You now have the responsibility of, in Utrecht, you'll be training your colleagues.
I relish that opportunity, actually. I'm looking forward to it. As it is, some of the knowledge that we've gained during our NIMAT training, we managed to impart it to our lower categories of staff, where you find that a security guard will be bringing you a patient to say, I think this one needs your hands. Or even a cleaner, while she was cleaning, say, I think this one needs to be coming in there by you. So I relish that opportunity to be working closely with my other colleagues.
David, thank you very much. And Matombi Nzimande from KwaZulu-Natal, thank you very much. And all the way from Utrecht, thank you very much for your time. Two of our nurses who've been part of the NIMAT program, and one that certainly has been hailed as an example. Really, it's done incredibly well. Over 1,700 nurses now in the province of KwaZulu-Natal who have been able to enable us to now reach the 1.2 1.3 million people who are now on ARV treatment. But it doesn't stop with them. They're still going out now to their respective communities, and they're going to train their colleagues, and the target for this year is 2,500 nurses. Well, we'll leave it there for now. Do stay tuned with us. More coming out from the AIDS conference in Durban.